Hello and welcome to this year's Medical Imaging Open Day presentation. My name's Gail Powell, Deputy Course Director of the Medical Imaging Program, and we are thrilled to have you here with us as we explore our medical imaging program. We'll also be hosting a live Q&A session straight after this presentation to answer any questions that you may have. Before we begin, I would like to show our respect and acknowledge the traditional custodians of the land on which our Deakin campuses are located, of elders past and present on which our learning takes place, the Gunditjmara people, the Wathaurong and Wurundjeri people of the Kulin Nations, and the Gunung Wulum Bolok people. Today I will provide you with an insight into what medical imaging is, what makes Deakin different, and why you should consider our program. I will talk about our mission, and I'll take you on a tour of our facilities and the state-of-the-art equipment, and provide you with information about our course structure, units covered, as well as discussing our work integrated learning program. We'll also talk about our student association, MISA, and the opportunity to meet like-minded students such as yourself to collaborate with. I will discuss career outcomes and opportunities as a result of completing this course, as well as course prerequisites and our regional and remote entry scheme. So what is medical imaging? How many of you have had a family member who has had an X-ray, CT, MRI, ultrasound, angiogram, or maybe a mammogram? This is all the work of a medical imaging practitioner. Medical imaging is an ever-evolving discipline. It's more than just X-rays. As this field expands, so too do your learning opportunities, as well as employment prospects. As a qualified imaging practitioner, you'll have the opportunity to work with a variety of what we call modalities, or different types of equipment, as well as a great team of healthcare professionals in a variety of settings. We perform these roles in large teaching hospitals, private clinics, rural and remote hospitals, as well as large metropolitan areas. Our job is more than just taking pictures. We have to have a deep understanding of anatomy, pathology, and radiation physics to assist in the diagnosis of disease, as well as patient care. Imaging is a rewarding mix of both technology and humanity. As I mentioned, you will work with a highly skilled team. And through the completion of this undergraduate course, you'll have the opportunity to work in the areas of general radiography, fluoroscopy, CT, theatre, mobile radiography, and angiography. You will also have exposure to advanced modalities such as MRI, ultrasound, and mammography. All our academics have had years of clinical experience, and we continually engage with our industry partners to provide current evidence-based teaching, with many expert guest lecturers presenting at various stages of your degree. Your learning and the continued development of our program is of our highest priority. So why choose Deakin? What do we do differently? Firstly, we pride ourselves on our aligned curriculum, which is integrated using problem-based learning. This means our students are grouped into small groups of about 8 or so students to one facilitator. Now, this facilitator is an academic within the field of imaging. This gives you the opportunity to meet and to collaborate with other students within the course in a small group. Each week, these students are assigned a case to work through. These cases incorporate the learnings from all the studies and different units across that particular year level. So for example, a case will include things such as anatomy and physiology, physics, as well as clinical practice that has been taught that particular week. These cases are based on real patient presentations, and each case is varied, with new themes being incorporated to give students the ability to discuss and develop thinking around these areas. This allows students to take ownership of their learning, as well as foster a collegial relationship, which is essentially how they will collaborate when they are qualified practitioners. Our anatomy and physiology is based on real medical imaging concepts, rather than just a generalised teaching approach. Students will also gain experience from a variety of clinical placements, as each student will complete work integrated learning programs in a variety of settings, from large metropolitan hospitals through to small rural centres. Due to our placement program and accreditation requirements, our cohort sizes are very small, approximately 60 to 70 odd students per year level. This means that academics get to know students on a more personal level. Therefore, you're not just a number. Our course and our learning experience for your students, as well as the integrity of our profession, is what drives us to ensure that you have the most personalised teaching program. We endeavour to know each student and how you learn to try and tailor our teaching towards that. Student experience at Deakin is a priority, and this is why we are the leaders of graduate satisfaction in Victoria for the 8th consecutive year, according to the Australian Graduate Survey. Here is an example of a problem-based learning group. You can see there about say 9 or so students, or it looks like 8 students actually, in the facilitator in the corner there, who work together to solve problems. So up in the left corner, you can see an image of a chest x-ray, which is what they'll be discussing that particular week, and the patient pathology and that sort of thing that they will be discussing. They'll be pulling apart the x-ray, unpacking what they know and what maybe they need to learn and to bring back the following week. So after a session such as this, they write down and discuss the things that they do know, and that's all written up on whiteboards, as you can see in the corner there. Then they identify what they do not know and where the gaps in their knowledge are. From here, they go home, research this information, and bring it back the following week to present that information and where they have identified those holes in their learning. So our mission is to produce medical imaging graduates who are eligible to get professional registration with AHPRA, the Australian Health Practitioner Regulation Agency. This means they are registered and ready to practice within Australia. They will practice with social, legal and ethical responsibility. Again, this is discussed as part of our PBL cases, as well as constant self-reflection through clinical and work integrated learning. We want to make sure they're grounded in specific scientific and evidence-based principles. Again, this is fostered through that PBL as well as assignments that are handed out throughout the year. We want to make sure they're work ready with high standards of clinical competence. They have the knowledge, skills and attributes to pursue postgraduate studies in advanced modalities if they wish to do so. At the end of our career, the end of their degree, they will be highly sought after by the industry and have developed a range of network opportunities throughout their placement experience. As I mentioned, our state-of-the-art equipment, you can see there in those images. We have 2 fully functioning X-ray rooms in our labs, as well as phantoms for students to practice with. We have mobile X-ray equipment, theatre X-ray equipment, as well as dental X-ray equipment. We also have a fully functioning and operational PACS system. This is a computer image database, which is the same that is used in the hospitals around the country. As we share facilities with medicine, nursing and optometry, we also have a great range of resources that we can draw upon for practical teaching. This includes things such as our anatomy labs, which we use for dissections, and access to anatomy models and specimens as well. Now, this slide provides a basic outline of our course and the subjects that we offer. I need to reiterate that medical imaging is a semester-based course, and we can cover a significant amount of contents. Hence, we deliver this content over a 16-week period, which is the semester, rather than the conventional 11-week trimester, as you would have heard many other courses deliver their content. A typical first-year student will start semester 1 with 3 units. So you can see that up here, Medical Radiation Science 1, Foundation Principles and Application of Medical Imaging 1, and Medical Imaging Practice 1. So radiation science is effectively physics, foundation principles and applications is anatomy and physiology, and then they have their clinical skills subject, which is worth 2 credit points, which is medical imaging practice 1. Year 2, you will notice, is much the same, a similar content, just development on the previous year's teaching. And then in year 3 and 4, we look into more research methods as well as practice management and introduce advanced modalities as well. As I discussed earlier, work integrated learning and clinical placement is an extremely important part of this degree. This ensures that students have had an opportunity to work in a variety of settings with real patients and real case scenarios. Over the duration of the course, you will gain experience of about 50 weeks over the 4 years. 6 weeks in year 1, 8 weeks in year 2, 12 weeks in year 3, and 24 weeks in year 4. This can be interstate, regional, rural, or metropolitan. Now, I will mention that the current COVID epidemic has caused a little bit of uncertainty in this space. However, we do try and make sure that our students get as much clinical experience as possible, but the safety and well-being of our students is our first priority. So we have had to make some amendments in this area this particular year, and is likely to continue next year until things sort of settle on that front, if or when that does happen. But I can reiterate that the safety and well-being of our students is our #1 priority. But also, in saying that, our qualification at the end of this degree has to ensure that the students are meeting the clinical skills required as well. So we will ensure that they will get some form of placement as well as lab skills to bridge that gap where necessary. We also would like you to be aware of the fact that clinical placement is self-funded. However, we do provide a range of grants and assistance to students to help with accommodation and placement costs throughout their degree. So here, this table again shows the subjects offered, as well as on the far right there, you can see how many weeks worth of clinical practice is incorporated into each year level, as I discussed earlier. 6 weeks in year 1, 8 in year 2, 12 in year 3, and 24 in year 4. So MISA, the Medical Imaging Student Society, is a society of students which was created to encourage and support students in medical imaging. We work closely with the Student Association to ensure that they provide support to the students, and also we learn from them as to what they might need in terms of their learning as well. So our aim is to create a friendly and supportive environment for members and teams to sort of learn and create networks between their peers, the faculty, as well as industry professionals. So we have industry nights where we get professionals from the medical imaging community to come and do presentations to the students, as well as just generally liaise with students and create networks as well. Every year we have a student competition, which is sponsored by the Epworth Hospital. So where students in first year come in and create a series of different X-ray images, and these are judged by the Epworth. And we have a series of prizes associated as well. So professional prospects. Currently, there is a shortage of radiographers in rural, regional and remote Australia. Hence, we're trying to bridge that gap. And this is why we send students to a variety of settings to expose them to a variety of patients, as well as they may find this is an area that they are interested in practicing in. If you are from rural or regional Australia, you will also be given a bonus as part of your application as well. So that's the rural and remote entry scheme, but we'll discuss that a little bit more later. Strong industry growth is continually forecast. With an ageing population, allied health professionals in particular there is greater demand, and there will continue to be that greater demand. We do have overseas opportunities as well, as our practitioners are recognised, and so many of our students will often do locum work overseas as an opportunity to travel and earn money at the same time. The commencing graduate salary currently, as far as I'm aware, is about $50,000 to $60,000. And you do have that opportunity for postgraduate qualifications in MRI and ultrasound, as well as research, teaching and business management. So as graduates, you will be prepared to pursue a career as a registered diagnostic radiographer. You could find yourself working in a radiology team in a hospital, private radiology practice, or health department. As a graduate, you will be able to work as a skilled practitioner across a broad range of medical imaging modalities, including, as I mentioned, general radiography, so plain film X-ray, CT, fluoroscopy, theatre, and angiography. So you will be eligible for ARPA registration as a medical radiation practitioner at the end of this degree. And ARPA registration enables graduates to work in a variety of settings as discussed: small regional clinics, large metropolitan hospitals, as well as specialised medical facilities within Australia. So this is a profile of one of our current graduated students, Kirsty Miller, who I think Kirsty was originally from Queensland and then moved to Geelong to study. She was heavily and actively involved in all campus life, became a representative for MISA, the Student Association, as well as on the Teaching and Learning Committee board, as well as a student representative. She's presented at our national conferences, and as well as undertaking a variety of placements all over the country. She must have really enjoyed her work here in Geelong, and has in fact continued and stayed here working at our local public hospital. She's a great ambassador for the program, and we are really thankful to have students such as Kirsty. But we have plenty more stories such as this of students who have really taken on board the challenge and flourished through our program. So what do you need to apply and enrol to be part of the MI program? As I should mention, the program is a 4-year program. This year, the campus ATAR was 88.45. It is at Warm Ponds campus. For school leavers, you will need VCE units 3 and 4, and a study score of at least 25 in English, other than EAL, or 30 in English EAL. In terms of science, you will need units 3 and 4 and a study score of at least 25 in biology, chemistry, or physics. In terms of maths, you will need VCE units 3 and 4 and a study score of at least 22 in maths, methods, specialist maths, or at least 30 in further maths. As I discussed the regional and remote entry scheme, this is only again for school leavers. There is currently a shortage of qualified, skilled and experienced radiographers. So therefore you get a bonus on your ATAR. So who is eligible? Current Year 12 students who are undertaking their final year of schooling at a regional or remote secondary school as identified by the new ABS categories that is not located in a major city of Australia. Current Year 12 students from schools in the city of Greater Geelong do qualify for this scheme. So please, if you do have questions regarding this, send them through, particularly if they're personalised in nature, and we'll be able to provide you with that information as we go along. So course and prerequisites for non-school leavers. Again, it's the same course, 4 years at Warm Ponds. For non-Year 12 applicants, same as Year 12 applicants in terms of the requirements on that previous slide that I sent through. So with your maths, science and English as well. Or if you have completed a bachelor degree in maths, science or health science, or a Cert 4 in a related discipline, or diploma in any discipline. Successful completion of relevant study at accredited higher education institute equivalent to at least 2 Deakin University units, or evidence of other academic capability judged to be equivalent, including, for example, successful completion of a foundation program approved by faculty board and or relevant work or life experience. So as I mentioned, please send through your individual questions and we'll be able to answer these through that Q&A session. There are a number of pathways if you say maybe don't quite get the score you need, and you can find another way in which of accessing the program. That is through studying a related course at Deakin and then transferring once you've achieved the requirements for the degree. Again, please speak to a student advisor to discuss your personal options. But some of these courses include a Bachelor of Biomedical Science, Bachelor of Health Sciences, Bachelor of Science, but you're best really, again, to talk to those student advisors. So non-academic prerequisites, to me, this is probably the most important part. This is where you need to work out, is this the course for you? You need to be motivated. A lot of work, particularly in this course, it's quite intense in terms of the workload, and you need to be a motivated learner. You need to be self-directed. Whilst we work in groups, you need to be able to have that collegial and teamwork approach, but it also needs to come from you as well in terms of your own personal motivation. You need to have empathy and understanding. You're going to be discussing patient cases in a variety of different presentations. You need to have empathy, and patient care is our most important quality, particularly in this role. You need to be a lateral thinker. As part of medical imaging, you need to be able to think outside the box. You will be presented with a variety of challenges, and you will need to think differently, not just follow a set structure, because sometimes that's not going to work and you're going to have to think on your feet under high pressure as well. You'll also need to be an effective communicator. This means that you will need to be able to talk to and have interactions with a variety of patients, with a variety from different cultures, from different backgrounds, from at different ages, from pediatric children to older patients as well. You need to be able to listen to your patients. You need to be able to listen to your colleagues, take on board criticism and advice. You also need to be a team player. Allied Health in particular has a huge focus on working as part of a team. You will work with nurses, with doctors, with other radiographers, as well as your patients. So you need to have that collegial approach. You also need to be resilient and be capable of adapting to any particular situation, as well as be willing to travel as part of your course. Thank you for for everyone for joining us today. It really is great to see so many of you interested in our program. If you would like to learn more, we encourage you to stick around for the live Q&A session, which is about to kick off. And if you need to head to another session, please explore our virtual open day website, where you'll find additional information, or speak to one of our experts on the live chat at any time throughout the day. We'll be able to and available to answer those questions. So once again, I thank you for your participation in today's session and look forward to hearing and answering your questions.